Welcome, everyone. Thank you for joining us for our presentation titled Cancer Advocacy. It is my pleasure to introduce you to Lori Dennison and Shirley Mertz. Lori is a 12-year breast cancer survivor, patient advocate, and breast cancer research advocate. Lori has volunteered as a Pink Ribbon mentor, served on the Join the Journey Board of Directors for 5 years with 3 years as president, and currently works to advance breast cancer research as a member of the Mayo Clinic Breast SPORE. Shirley Mertz is a breast cancer survivor who works with multiple patient advocacy groups, including serving as the chair of the Metastatic Breast Cancer Alliance and the president of the Metastatic Breast Cancer Network. Shirley has been honored by the White House as a champion of change in breast cancer and was named by the Susan G. Komen Foundation one of the 35 global individuals who have made a significant impact in the fight to end breast cancer. For a complete biography on our speakers, please visit the Biography tab at the top of your screen. Please join me in welcoming Lori Dennison and Shirley Mertz. I will now turn the presentation over to them.
Thank you so much for having us today. It's a true honor to speak to you. As indicated, my name is Lori Dennison, and I'm here with Shirley Mertz. Shirley and I met because we both serve as a patient advocate for the Translational Breast Cancer Research Consortium, or TBCRC. We would like to start by sharing our breast cancer stories as we represent a couple different perspectives. I from more of an early stage perspective, and Shirley from a metastatic perspective. After sharing our stories, we would like to turn our discussion more to the future. So I will start out with my story, and please bear with me because I am going to read most of this. This is actually an article that I wrote shortly after my breast cancer diagnosis. It was a day just like any other day, a June morning, and I was up at the crack of dawn, scurrying to get to work because I had a million irons in the fire. I arrived about 7 a.m. to try to sneak in an extra hour before a full day of meetings kicked in, only to realize I had the dreaded mammogram appointment at 8 a.m. I had already rescheduled it several times, and I knew I had to just get it over with, so I rescheduled a few meetings and headed over to my appointment. Much to my surprise, I was in and out of there in 45 minutes. That wasn't so bad, I thought to myself. I can actually make my 9 o'clock meeting. Shortly after 11, the familiar sound of my overworked pager went off. Instead of the usual client concern about a computer issue, it was a nurse calling me about my mammogram. She said I needed to come back for more pictures. I wasn't surprised because I had a nodule of normal breast tissue in my left breast for about 10 years. I remember snapping back at her, well, it's not going to happen today because I have a full schedule. Bless her heart, she calmly responded with something to the effect that I shouldn't be alarmed, but that it was important for me to make the time for this appointment. So I rolled my eyes sort of over the phone and took a deep breath and exclaimed, this happens every year. After a bit more arguing, I agreed to go back that afternoon. Later, after several mammograms and ultrasound and scheduling a return appointment for a biopsy, I headed home for the day. This is ridiculous, I thought. It's the same round, slippery, soft, movable, large grape I've had for 10 years. I don't have time for this. Little did I know it had nothing to do with the existing nodule. A few days passed and thoughts began to race in my head. They had always assured me that this nodule was normal breast tissue and wouldn't likely turn to cancer. But what are they seeing? Could things have changed? What if it's cancer? I don't know the details, but my grandma had cancer when I was a child. I bet that's what it is. Oh no, I do have cancer. This time, I couldn't get to my biopsy appointment fast enough. It was an ultrasound guided biopsy, and the two women performing the test were so nice to me, reassuring me that everything would be fine. They were just going to take a couple small biopsies and I would be on my way. Well, 12 small punch biopsies later, and it still wasn't clear if they found what they were looking for or not. They kept looking at each other, pointing at the ultrasound screen and saying, "Do you think that's it?" It was then that I realized they weren't looking at the existing nodule. Needless to say, I was a wreck. I knew in my gut it was cancer and they didn't find it. I left the appointment and called my sister sobbing. They didn't find it. I know it's there, and they didn't find it. A week went by with no results. I couldn't stand it any longer, so I called the clinic to see what was going on. My physician was on vacation, so her nurse called me back with the results that the biopsies were normal. She said everything was fine and that I should schedule my next mammogram in a year, as I usually do. While this was good news, instinct told me that it wasn't right and that I needed to follow up with my physician when she returned from vacation the following week. Much to my surprise, I received a call from my physician early and personally to discuss my biopsy results. She had the same concern I did. The tissue found in the biopsies was normal breast tissue and didn't match what she expected to see on the mammogram or the ultrasound. We both agreed that it needed to be pursued further. She made some calls and was told that the previous biopsies would need to heal for 3 months before further testing could be done. A follow-up mammogram appointment was scheduled for September, and that was the longest summer of my life waiting. September finally rolled around and it was back to the drawing board. I had another mammogram, an ultrasound, and an MRI. The good news was that they did finally find it. The bad news was that there was now 3 spots instead of 1, and the largest one was now invasive. At that point, I was diagnosed with grade 1 ER/PR positive tubular carcinoma in my left breast, ironically just adjacent to the prior biopsy site. The main tumor was approximately 1 centimeter in size, and the other 2 were pretty close to the chest wall, but much smaller. And so the journey began. The next 3 weeks were a whirlwind filled with tests and decisions, the details of which I don't really recall much anymore. My only option at that point was a mastectomy, but I did need to decide on a single versus double along with reconstruction options. After much research and several discussions with my pink ribbon mentor, I decided to go with the double mastectomy with silicone implants. I remember being so relieved to finally have a diagnosis with a plan to move forward and kick this cancer in the butt. I also remember the invaluable piece of advice from a physician in the breast clinic that I remind myself daily. She said, "For you, this will be a 2-year interruption in your life. There will be ups and downs along the way, but if you keep positive, and take one day at a time, you will get through it." And that was the turning point for me. I put my life in the capable hands of my physicians and did exactly what they told me to do. The next 2 years were definitely not a picnic. There were multiple surgeries, a couple infections, a cracked rib doing expansions of implants, and a few other minor setbacks. But all in all, things went very well. There was no lymph node involvement, so I didn't need chemotherapy or radiation. The closest I have come to winning the lotto. So that's my story, and I will turn it over to Shirley for her story.
Wow, Lori, I just have to say, your story certainly exemplifies the anguish with which patients feel when they go through this process, the long wait for results, the worry. It was a very beautiful story, and I agree with you. It's hard to tell, but it does have meaning to other people, especially other patients.
Right. Yeah,
so my story goes the span of 29 years. I have been living with breast cancer for 29 years. And I should say, not only do I live with it, but my family. I have a husband and 2 sons. In my mid-40s or early 40s, I heeded the call to the importance of getting a mammogram, even though my family had no history of breast cancer. And in 1991, calcifications were found in my left breast. and a biopsy was done, and the pathology report showed that indeed it was breast cancer and that it was ER/PR positive. At that time, lumpectomies were newer, and I was told that I could have my breast removed or I could have a lumpectomy. I chose, like you, instead to ask for a double mastectomy. And because I viewed at that time that might bring me closer to a cure, because I didn't want to deal with breast cancer again. And so although at first my surgeon was reluctant, that was my choice. I did not choose to have reconstruction at that time, and I have not had it done since then. At the conclusion of my surgery, when I met with my surgeon again, he said, "Shirley, you are cured. Go on with the rest of your life." And wow, my husband and I heard those words. He wrote them on a piece of paper and he hung them up in the bedroom so that we could look at it. I have to say, though, I had my doubts. I thought, was the surgery enough? What if some little cancer cell slipped out? So I went to the oncologist that was associated with the hospital and said, "How about if I have something else?" And she said, "What do you want?" I said, "Well, how about chemo?" And she said, "That's ridiculous." No, she says, "You don't need anything else." So I tried to calm myself and go on with my life and my career. And I went for 12 years with no return of my breast cancer. And then in 2003, I did feel a pain in my rib cage. I went back to my internist and I mentioned this, and she said, "Well, let's do a bone scan." So a bone scan was done. There was nothing wrong with my rib cage, but instead there were 3 suspicious spots found on my spine. So a biopsy of my spine was done, and the pathology report came back. And this time, the pathology report said that my metastatic disease was hormone negative, ER/PR negative, which I thought, wait a minute, it's different from early stage. And I also got the news from my internist. She said, "Shirley, I'm sorry to tell you these things, but you probably will live only 1 or 2 more years." I can't tell you how shocked I was. I was frozen in the chair. And then I decided I had to see what I could do and make the best of my situation. I was referred to a community oncologist who I found out later treated patients with breast cancer and also gastrointestinal cancers. His decision was to treat me as if I still had hormone positive breast cancer. And I said, "Why?" It says, the pathology report says hormone negative. And he said, "Well, first of all, bone does not biopsy well." And he says, I really think that you're still hormone positive." Well, being a good patient, I said, okay. And I started taking Arimidex, which he recommended. The only other thing that he said to me, though, that was startling was he said, "You need to take this for a year, and then I will scan you again to see if it's working." I said, "A year?" He said, "Yes, anti-hormone agents take a long time." So 6 months went by. I happened to be seeing a new primary care physician and told him of my situation. And he said, "Shirley, you can't wait a year to find out if your treatment's working." He said, "I'm calling your oncologist." So he called him and a PET scan was ordered. And on that PET scan, the results were that my entire skeleton was lit up. And there were 3 lesions in my liver that lit up on the PET scan. I could not believe it. I was shocked. I was scared. I cried. It was Friday when I was told by my oncologist that these were the results. And he said, "But I do want to see you on Monday, and we will start chemotherapy to attack this." I thought long and hard over that weekend. I had been raised in a working class family to respect teachers, to respect religious leaders and doctors, and to do what they say. But this just did not feel right, that I just go jump into chemotherapy. So on Monday, I let them know that I was not coming in for chemotherapy, and I decided to get a second opinion at a comprehensive cancer center in Chicago associated with a university. And I met an oncologist there who treated many metastatic breast cancer patients. And in retrospect, I found out that that's a real important point for patients to realize. She ordered a biopsy of my liver, and pathology report came back and said, indeed, my cancer was ER/PR negative, and it also showed that my cancer was HER2 positive. So my cancer had indeed changed from my early stage in 1991. The doctor suggested, and I totally agreed, that I would take Xeloda and trastuzumab or Herceptin. And after 8 weeks of Xeloda, a CT scan was done to see how my treatment was working, and it showed that my liver lesions were reduced by 50%. So I was hopeful, and we continued. And that regimen was continued through April of 2005. In fact, it was April 1st when a PET scan showed that there was no evidence of disease in my body. I mean, I remember the fellow associated with the oncologist who said, I can't believe that you had no evidence of disease because of as much burden of metastatic disease that you had. Well, I was elated. I felt blessed. I knew I was not cured. And my doctor said, I'm going to take you off the Xeloda and continue with the Herceptin. But I now had hope for the future, real hope. And I decided to give back to the community by becoming a patient advocate, speaking to patients, finding out more about research. And my story to them was a biopsy is very important. Pathologists are very important, although we rarely ever see the men and women who deliver those important results. And a second opinion is important, especially a doctor that treats a lot of metastatic patients, as well as one that's associated with a comprehensive breast cancer center. And finally, I urge patients when I advocate to find out about their breast cancer and learn as much as they can, because knowledge is power. So from 2005 to late 2013, I followed this regimen. I had regular physical exams, and I was asked questions about my pain level, whether I had new symptoms, how was my sleep, and that was always pretty bad, and what was my anxiety level. Every 3 months, and I have to say that's really often though, 4 times a year, I had PET scans. A few CT scans, but mostly PET scans were used to follow my care. I had CBC counts, comprehensive metabolic panels, but during this time, I certainly never was offered any tumor marker tests. I was made aware that if I continued these PET scans, I could be opening myself up to more cancer because of the radiation. And I really wished then that there was something simpler, less complicated than PET scans that could help monitor my disease. And then in 2014, a PET scan revealed uptake in a lymph node in my upper left clavicle area. It was biopsied, it was metastasis. And a pathology report this time showed that my tissue in that lesion was now estrogen positive. So I am unique, and this only happens, I think, to about 10 or 15% of patients, but my cancer had mutated again. So surprise, but now, in addition, 3 other diagnostics were done. I was given a CA 15-3 tumor marker test, and the tissue from my lesion lymph node was genomically tested to find out what kinds of mutations I had. And I was given a genetic test to determine if I had a germline BRCA1 or BRCA2. So since 2014, my cancer 15-3 tests have been given to me every 4 or 5 months. It's been made clear to me, though, that tumor marker tests are not good for everyone. No treatments, changes are made just on the basis of a tumor marker test. But for me, they offer some comfort. And for some patients that I've talked to, they do reflect a change when their cancer gets worse. But for others, they're useless. As to imaging, I do get PET scans still, but only twice a year. They certainly have become more difficult to get approved by insurance carriers. And as to the lymph node that I had, because it was too deep to be removed without opening up my chest area, I chose to have it ablated through stereotactic radiation. And of course, now I'm taking an anti-estrogen agent, exemestane, for my disease. So I think, that is my story, maybe a little bit too much detail, Lori, but I think that given your story and mine and the understanding that we both experienced, we've both had with waiting for results, worrying about results, and still, like for you, wondering, will my cancer come back? Even though you've taken a very aggressive stance, as I did, we just don't know. And so what do you think you would like to see different in the future for people like us in terms of testing?
I think, one of the things that I'm hearing a lot of echo. Are you hearing echoing there, Shirley? Okay, I guess that's just me. So I think, we've both had, I think, for diagnosis and, ongoing, mostly imaging. I think imaging has been the big thing. It's so expensive, and the insurance companies, like you said, they don't want to pay for it. When I was diagnosed and took the mastectomy option with implants, they actually told me that I would get MRI every 2 years just because they wanted to monitor and they couldn't do a mammogram anymore. And I was pretty excited about that, even though it was quite invasive. But I felt like somebody was going to be, there was some way to monitor where I was at and whether I would, have a reoccurrence. I think that's the biggest gap for me, right there is I finished. I had my mastectomy. I had my implants, and then they kind of said, you're cured. You have a 5% chance of reoccurrence. Go live your life. Well, that's great, but for me, I worry every day because there's no monitoring or anything like that could catch a reoccurrence. It's just me looking for lumps or responding to pains like you did, Shirley. But I think we need something simpler. We need like a simple blood test or something that we could get on a yearly basis to just look at, is there any activity in the body? And if not, that's fantastic. I think, we need something that the insurance companies won't balk at. And even if they do, we could probably, afford something like that, and so I guess for me, secondary, once something is really suspected, that's probably a really good diagnostic tool. But, for that time period where, you don't have anything suspected and you just want reassurance, or you want to catch, the ability really to know, is there activity? Do I need to be concerned about something, so that you can have peace of mind and just, kind of go on with your life.
Right. And I think from what I've learned that a blood test has been developed in some other cancers, I've been reading lately, where it does portend that this, an individual patient may be having, maybe getting another cancer in the near future. I don't know if there's anything perfect yet, but biomarker tests would certainly make a difference in the early stage setting, like you have been. You've been treated, you've been told, you're fine right now. But that ongoing, I was once told by an oncologist, well, I heard him in a presentation say the only way a woman is really cured of breast cancer is until she dies of something else.
Yeah, right.
I mean, it's kind of depressing to think about, but the point is, we have tests for diabetes. We have tests for PSA. My husband recently had prostate cancer, and his PSA levels were followed. Well, women are worthy of that also, and men, because men do get breast cancer. But I think there's more research spent on biomarkers that could be obtained from blood. There's certainly, I've sometimes, just like you, I've sometimes waited a week for the results of my PET scan. And that is an awful week. I mean, you try to distract yourself and think about it. I used to do what I called awfulize. Okay, if they tell me it's worse, what am I going to do then? And I finally got the point to say, Shirley, straighten up and think about, what if it's good news?
You're right.
Biomarker test could identify if we are progressing, and then then steps can be taken. I think the worst thing that happens is to find out that we have breast cancer when there is a heavy burden of it, because that's harder to treat when it's spread all over, or especially
to catch it earlier than that. Right.
So I think if doctors could, right now, I did a little research for this presentation, and I'm aware that ASCO and NCCN and ESMO do not, recommend regular tumor marker tests. I think because, like I said, they vary among doctors. The usage varies among doctors. And then I have spoken to many patients with metastatic disease, and some will say, oh, my tumor marker test really helps me follow my breast cancer progression. Others will say, wasn't any good for me, didn't show a thing. And then still others say, my doctors don't even use them. So there isn't clarity in the clinic, if I could use that phrase, about tumor marker tests. And I think that they could, things need to change. And I'm hoping that people who are listening to this, to us, will say, yes, this is worth doing.
Right. Yeah. I mean, I think, one of the worst things, okay, we had breast cancer. For me, I hopefully am cured. They told me I was cured, go on your, with your life, but I still worry about it every day. I think, right out of treatment, they said, I mentioned this in my story that, they said, 5%, go ahead, live your life, you're good. But now I hear, I think there's been, some changes in the awareness that at the 10 to 12 year mark, actually the cancer that I had, which they said was one of the least likely to reoccur, right out of the gate in 2008, they're now saying is one of the higher ones to reoccur. And so, that gives me, just a lot of stress every day. And so if I just had that, and I have no follow-up actually right now. I don't have mammograms. I don't have MRIs. I don't have PET scans. I don't really have anything. I don't even have doctor's appointments necessarily.
Well, and you and I share that we don't have breasts. I mean,
right. And
how could we have been followed when our breasts were removed? which we don't
Yeah,
regret.
right.
I never regret removing my breasts. No.
No, me either, because I really, it did give me peace of mind from being able to, that I did everything that that I could.
Yes.
But I do, I'm having increasing stress now, now that I'm at the 12-year mark, and I hear, more about the reoccurrence. Even, you said, you were at the 12-year mark, that, that something like that, could happen. And if I were able to just, go in once a year, have some sort of a simple test, and then, either, yes, there's activity, yes, there isn't, like I said, but.
Lori, could I just share with you a little piece
please.
of mine? We are friends from TBCRC.
Right.
One of the things that often happens to me is that because I know many metastatic patients, some of them will pass away. And then, of course, just like you hearing about a recurrence, I get nervous. I think, oh my God, death is around the door. But what I told myself, and I've learned over the years, is that every one of us is a unique patient. We all have a subtype. We have different comorbidities. We have different genetics. So you are unique. And even though you read something about the 12-year, danger time, etc., remember that no one else is like you. So your situation, be optimistic that it won't come back, but that doesn't mean that you and I don't want the people listening to this recording to do something to help the breast cancer community, both early stage and metastatic, to pursue better biomarkers so that we know about our cancer and we can have the reassurance
Earlier.
And give our clinicians some options of yes.
And I sometimes wonder too, if the biomarkers wouldn't have helped diagnose mine, because we relied on MRI, which definitely showed, it lit up, it showed that I had, a spot. But then when we did the biopsies, they just missed it. I mean, it was a smaller cancer, and they missed it. I mean, no fault of theirs. They just missed it with the needle biopsy. But I just wonder if, in combination with those more, invasive type tests and scans, if something like a biomarker, blood test or something like that could have said, yes, we do see activity in there is cancer in there, and that we could have looked further before it progressed. And even though I feel like I was still lucky because it was early enough, by the time we did the second batch of testing, but it's still, it had become invasive. I had 3 tumors now that had advanced that were, close to the chest wall, and, by our, where they, what's it called? Anyway, so mastectomy was my only option, put it that way. Lumpectomy was not an option anymore for me. But, I feel like that in combination might have been able to catch something that the physical test, didn't. Right.
Well, this has been delightful to get to know you better, Lori.
Yeah.
And I think we both want to thank Abbott for the time that they've allowed us to not only share our stories with each other, but share our stories with those who are attending this conference. And I wish you a great day. And I hope that this COVID-19 gets a solution so that you and I can once again be in a TBCRC meeting face to face. Right. Thanks, Laura, so much.
Yeah, thank you. Yeah, and I'll just as a few ending comments too. There's always a little good with every bad, and I feel like my life has changed forever, but I am alive and active, and I really would appreciate some way to not have to worry about this every day. I mean, I feel blessed, that I did get as far as I got. I just turned 58 yesterday. And I'm super excited about that, even though I think at one point I wouldn't have been very happy about turning 58. But
yeah, the alternative is far worse.
Every year is a blessing. And, you know, I do feel like I was probably given, you know, a second chance to live life to the fullest. And I really want to be able to do that without worry. And, you know, I just think like the best gift would be to have some way to easily check an annual blood test or whatever, you know, it could be, to just for that little bit of peace of mind, to go on with my life and live it to the fullest without all that. And as you said, you know, I feel like the people watching this are the people that could help make that happen. So I they can.
Yeah, we're one of the same mind. Great to be with you.
Yes, you too. Thank you.
Be well.
Right.
Ladies, thank you so much for sharing your touching stories. I do have a few questions for you, if that's okay. Shirley, I hear that most of the tests you've had were imaging. How did that affect your physical and your mental health?
Well, so far physically, I don't believe that all the radiation I have been exposed to has resulted in another cancer, though I clearly have been told that that does happen. And so that has kind of been another thing in the back of my mind, but I try to put that aside because I don't have any other alternative. You know, it's like, okay, choices, A or B or nothing. So I go with the imaging. And as far as my mental, as I tried to allude to in my story, I dread to schedule an image. I dread to schedule a PET scan. But then I say to myself, are you just going to let this come back without even knowing it? So I make the appointment. I go in there and get it done. And then there's this wait to get the results. It's just, oh. And then, you know, you worry, you imagine the worst. So it is mentally draining. And of course, I have a husband and 2 sons that love me dearly, and they're on pins and needles because they don't want to lose their mom, their wife. So it's difficult, the imaging. But until 2014, when I was introduced to the CA15-3 tumor marker, frankly, I had never had one done before. And so that has brought me some comfort, even though I've been told it's not perfect. But for me, it has had some reaction to the time when I had my recurrence in my lymph node, and then it's gone back down. And I watch it each time, and I usually get it done right when the PET scan is going to be done, so I can think, okay, how's it looking and what might I expect? But so I hope I've answered your question.
Yes, you did. And this question is really for both of you. Do you wish that you've had a magic blood test, a non-invasive test that would have been able to catch the cancer at an earlier stage?
Of course.
Of course. Yeah, I mean, you know, I can start with that, I guess. You know, for me, I think that a blood test, a magic blood test, you know, a magic wand, if you want to call it that, I really feel like it may have helped diagnose mine earlier. You know, there was a period of 3 months in there where my cancer had, you know, to grow and to advance because, you know, we didn't find it on the imaging, you know, and the biopsies before. So, you know, I do feel like if there was some blood test they could have done in combination with some of those, you know, tests that would just take, you know, a little bit different angle at it. Or even, you know, they called me back with my results and said, you're good, you know, go, you know, go about your life, schedule a mammogram in 1 year. If I would have waited 1 year, you know, it had advanced quite a bit in the 3 months that I had to wait for the healing. And if I would have had a blood test or something. I mean, if if I had a magic wand, I would have a blood test. It's simple, it's fairly inexpensive, and you can get the results quickly, and it's pretty non-invasive. So yeah, I do wish I had that. Mm-hmm.
Shirley, do you have anything to comment?
Well, I think in terms of the imaging that I've had, and I didn't make this point when you asked the original question, the financial cost of imaging is growing, and the pushback is coming from insurance carriers who are saying, women are more attuned to their disease, and they are going into their clinician to say, well, how am I doing, and how do you know how I'm doing? Could I have another test? Because that's all we can ask for at this point, until we have a definitive blood test. I mean, the tumor markers right now are not definitive or able to be used in the way that we've been wanting them. So the pushback has come from insurance carriers. There's more burden than financial toxicity to the patients, because they either have co-pays, or sometimes it's not approved at all. You may have had one and they say, well, you're only allowed one a year. Well, you're going to pay for another one? I mean, those are not cheap. But so really, we need research. We could call it magical, but we need focus on research to develop a biomarker for the monitoring of breast cancer, whether in the early stage or in the metastatic stage, hopefully to prevent metastatic breast cancer.
And can I interject, one more time, because I didn't think of this until now, but I think it would be super helpful for younger patients as well. I was in my early 20s when they found the benign nodule that I had, and they watched it with a mammogram, and I was in my 20s, so normally, I was way younger than a normal mammogram, the age for a mammogram. And honestly, I was 42 when I was diagnosed with I was 46, I'm sorry, when I was diagnosed with breast cancer. And that's still younger than, a normal mammogram, where you get an anti-mammogram. So had I not had this benign nodule to begin with that they were watching, I would have never had the mammogram to begin with. And so in a younger patient like that, I had this benign nodule, but with a blood test or something much similar, they may have been able to follow me, in younger patients, and I'm also a part of a Pink Ribbon Mentor group that mentors newly diagnosed patients. And we are seeing so many now, in their 20s, in their early 30s, and they're finding them and their more advanced cancers because they don't get regular mammograms. They're waiting to find that lymph node or that lump and that kind of thing. And if we had access to blood tests and tumor markers, and we could probably find some of these earlier stages as well. So I just feel like that may have helped me even follow me when I was younger.
If we can find, Lori, I think you would agree with this. If we can find a PSA, a biomarker for men's prostate cancer, why can't we find a biomarker for women's breast cancer? Come on, we deserve this, just like men deserve to monitor their disease.
And even Cologuard, Cologuard is another example. I know that's not a blood test, but it's a non-invasive way to predict, colon cancer. So, there's.
So it's not 100%.
Right.
Not 100%.
It isn't, but it's still a better screening than nothing.
Yeah. People are fearful of that.
Yeah, than nothing, which is what I'm, being monitored for right now.
Thank you so much. Shirley, you mentioned that tumor markers helped you in your second fight for battling cancer. Can you explain how that impacted your treatment journey?
Well, since I had my first tumor marker that you're mentioning in 2014 after the lesion, lymph node was found to be metastatic. And up till that time, I had not had any lymph nodes involved. I have the tumor marker antigen done regularly. I'm not obsessive about it, but I would say 3 times a year. And it really makes a difference in my mental well-being. I mean, it comes back within, I would say, 48 hours. I can look on my chart and see the result. And, you know, that's you have to have under 30 is considered normal. But anyway, so I watch that, and they even give you, you know, a decimal point, you're 5.7 or whatever, 5.9. And it just brings comfort to me. And I mean, I know I still have to face the imaging, but it's helpful. And I really appreciated that my clinician was willing to suggest it. She told me about the limitations, but I still find it very helpful to me dealing. And, you know, I just finished in August, was 18 years living with metastatic breast cancer. It's a long time to worry about when is the shoe going to drop. So, and that's about what, you know, if we let ourselves think about it, it's daunting. So we have to be busy about our purpose and enjoying life and helping others when we can.
Yeah. And Lori, what gives you peace of mind every day, knowing that this ugly disease isn't active in you again? And what would you wish to change if you could?
Yeah, I think, you know, I decided early on that, you know, after the physician told me this is an interruption in your life. And I think for me, she said it's a couple-year interruption in your life. You're going to get back to your life. With your type of cancer, we caught it early. We're going to do everything we can, and you'll live a long life. She told me that. And so honestly, I still bring myself back to that when she told me that, just to give myself peace of mind. You know, I did, you know, have the best treatment I could have. I had also had a hysterectomy a couple years before for some abnormality. And, you know, that helped as well, cut the estrogen, seeing that my cancer was an estrogen progesterone positive cancer. So, you know, there's so many things that point to that, you know, I'm good, and I should just live my life, and I can't, you know, I shouldn't worry about it every day. But I will say that I'm a worrier. And as much as I have chosen to be happy about it and to move on with it, but I've also addressed it head on. So I feel like I've become a pink ribbon mentor. I mentor newly diagnosed patients. I help give them hope, because they can see that I, you know, got through cancer, and I'm living a normal life, which is hopeful to them. I'm also, you know, a patient advocate for research, so that I'm also giving back there and help, trying to, you know, and hoping to help the research, further the research in breast cancer as well. And I think the only missing piece for me is really some way, like we said, you know, magic wand. It would be a simple blood test. I could go in, you know, even once a year, multiple times a year. I don't know what, you know, whatever was determined, but just for my own peace of mind to say, yep, everything is still good. And then I could just go on, you know, doing good things and helping others and living a happy life. But I am a little bit of a worrier, and I do need a little bit more peace of mind. And right now, I'm not being monitored at all, you know, only just my own monitoring. And I fear that by the time I find something, or there's a pain, or there's a a lymph node, that it will be advanced. And so, yeah, that would just be the frosting on the cake. It's just to have that peace of mind.
Thank you again, Lori Dennison and Shirley Mertz, and thank you for sharing your incredible personal journeys and for that outstanding discussion. We hope you found today's presentation informative and insightful. This presentation will be available for on-demand viewing. Don't miss out on our other valuable presentations on our agenda. Visit the Agenda tab in the auditorium for a full listing. Thank you again for your participation. Until next time, goodbye.
Bye.
Bye.